If you're over 60 and your energy has been steadily disappearing, I want you to know something important. Persistent fatigue is not something you should automatically accept as just getting older. In my experience caring for men in this stage of life, I've seen how several treatable factors can quietly drain strength, motivation, and vitality, and one of the most overlooked contributors may be hiding in your daily routine. Now, I'm not talking about feeling tired after a long day, a poor night of sleep, or an unusually demanding workout. That kind of fatigue is normal. What concerns me is when you wake up tired, struggle to get through ordinary activities, lose your stamina, or feel as though your energy simply isn't what it used to be for weeks or months at a time. As a physician, I want to approach this from a practical perspective. Aging does bring changes to your muscles, sleep patterns, metabolism, hormones, and recovery. But those changes do not mean you should automatically assume that a major decline in energy is inevitable. Sometimes there is something specific contributing to it, and identifying that factor can change what you do next. This video is for general educational and informational purposes only and is not a substitute for personalized medical advice. If your fatigue is persistent, severe, worsening, or accompanied by other concerning symptoms, please speak with a qualified healthcare professional. Today, I'll walk you through the major factors that can influence your energy after 60. We'll look at sleep quality, nutrition, physical activity, muscle loss, medications, stress, hormonal changes, and medical conditions that can sometimes show up first as unexplained fatigue. I'll also explain how to distinguish ordinary tiredness from a level of fatigue that deserves closer attention, and later, I'll reveal one commonly overlooked factor that many men don't realize can quietly keep them feeling drained. My goal is not to promise you unlimited energy or pretend that aging has no effect on your body. It does. My goal is to help you understand what may be changeable and what may deserve medical evaluation. So let me ask you something before we begin. When does your energy usually feel lowest? Morning, afternoon, or evening? Share your answer in the comments. Your pattern may be more informative than you realize. As you move through your 60s and beyond, it is reasonable to notice some changes in stamina. You may not recover quite as quickly after physical activity, and a busy day may leave you more tired than it did 20 or 30 years ago. That can be part of normal aging. But there is an important difference between getting tired because you have done something demanding and feeling persistently drained without an obvious reason. If you can mow the lawn, take a long walk, work in the garden, or spend a day with your grandchildren and feel tired afterward, that is a normal response to exertion. What concerns me more is when ordinary activities begin to feel unusually difficult, when you wake up already exhausted, or when your energy seems consistently low for weeks or months. Those changes deserve more attention rather than simply being labeled old age. Your energy is influenced by several systems working together. Your sleep determines how well your body and brain recover. Your cardiovascular system delivers oxygen and nutrients throughout your body. Your metabolism converts the food you eat into usable energy. Your muscles provide the physical capacity to move and perform daily activities. Nutrition supplies the raw materials your body needs, while hormones help regulate many of these processes. When one or more of these systems is struggling, you may notice the result as fatigue. Sometimes the cause is straightforward, such as poor sleep or inactivity. Other times, persistent fatigue can be associated with medications, nutritional deficiencies, hormonal changes, or an underlying medical condition that deserves evaluation. The important point is that you don't have to guess. Instead, start paying attention to the pattern of your energy and what seems to influence it. And there is one surprisingly ordinary factor I want you to think about before we move on. It is something many men do every single day, often without realizing how strongly it can influence energy, recovery, and even how alert they feel the following morning. In the next section, we'll look at sleep and why spending enough hours in bed doesn't necessarily mean you're getting the restorative sleep your body needs. You can spend 8 hours in bed and still wake up feeling as though you barely rested. I see this distinction often because sleep is not simply about the number of hours you spend with your eyes closed. The quality and continuity of that sleep matter. If your sleep is repeatedly interrupted or your body is not moving properly through its normal sleep stages, you may wake up feeling exhausted even when the clock tells you that you had enough time in bed. One condition I especially want men over 60 to be aware of is sleep apnea. With sleep apnea, breathing can repeatedly become restricted or stop during sleep, causing brief disruptions that you may not fully remember the next morning. Loud, persistent snoring, gasping, or choking during sleep, morning headaches, and significant daytime sleepiness can be clues that deserve attention. But sleep apnea is not the only reason your sleep may be poor. Frequent nighttime bathroom trips can repeatedly interrupt your sleep cycle. An irregular sleep schedule can make it harder for your body to maintain a consistent rhythm. Alcohol may make you feel sleepy initially, but can disrupt sleep later in the night. And caffeine consumed too late in the day can remain active in your system long enough to interfere with falling asleep or staying asleep. The problem is that many men gradually adapt to poor sleep and begin to assume that feeling tired during the day is simply what happens after 60. I don't want you to make that assumption automatically. If you are regularly fighting sleep during the day, waking repeatedly throughout the night, snoring loudly, or having someone tell you that you gasp or stop breathing while asleep, it is worth discussing with a healthcare professional. Sleep is one of the foundations of energy, and improving it can sometimes make a meaningful difference in how you feel during the day. But even when you sleep reasonably well, there is another major factor that determines how consistently your body has the resources it needs to function. That factor is what you put on your plate, and just as importantly, whether you are giving your body enough of the right nutrients consistently. In the next section, we'll look at how nutrition can quietly influence your energy and why simply eating more food isn't necessarily the answer. What you eat can have a surprisingly strong influence on how you feel throughout the day. And one of the mistakes I see in older men is assuming that low energy simply means they need to eat more. In reality, the issue is often what they are eating, how balanced their meals are, and whether they are consistently giving the body the nutrients it needs. As we get older, maintaining adequate protein becomes especially important for preserving muscle mass and physical function. If your meals regularly contain very little protein, you may not be giving your body enough of the building blocks it needs to maintain muscle. That doesn't mean you need an extreme high-protein diet, but it does mean that foods such as fish, eggs, poultry, dairy, beans, lentils, and other appropriate protein sources can have an important place in a balanced eating pattern. I also want you to pay attention to the quality of your carbohydrates. Meals dominated by highly refined carbohydrates and added sugars may provide a quick source of energy, but they may not keep you satisfied or energized for long. Fiber-rich foods such as vegetables, fruits, beans, and whole grains can provide carbohydrates along with nutrients and fiber. Healthy fats from foods such as nuts, seeds, olive oil, and certain fish can also be part of a balanced diet. And don't overlook hydration. Even mild dehydration can make you feel tired, sluggish, or less focused. Your individual fluid needs depend on factors such as your health, medications, activity level, and environment. So the goal isn't to force yourself to drink enormous amounts of water. It's to maintain appropriate hydration for your circumstances. Most importantly, energy is not simply a calorie-counting problem. Eating more calories won't necessarily solve fatigue if the overall quality and balance of your diet are poor. What matters is providing your body with a consistent combination of protein, fiber-rich foods, nutrient-dense carbohydrates, healthy fats, fluids, and essential vitamins and minerals. If you're finding this useful, take a moment to like the video, leave a comment telling me what a typical breakfast looks like for you, and subscribe for more practical information about healthy aging and men's health. But here's something important. Even a well-balanced diet may not completely restore your energy if your body isn't getting enough movement. In fact, too little physical activity can create a cycle of reduced strength, lower stamina, and increasing fatigue. That's what I want to explore next, because preserving your muscles may be one of the most important pieces of maintaining energy as you get older. One of the biggest changes I want men over 60 to pay attention to is the gradual loss of muscle and physical capacity that can occur with aging. Some loss of muscle mass is a normal part of getting older, but how much strength and function you maintain is influenced by how active you remain. When you stop challenging your muscles, they have less reason to maintain the same level of strength and endurance. This can create a cycle that is easy to miss. You move less because you feel tired. Then, because you're moving less, your muscles gradually become weaker and your endurance decreases. Everyday activities that once felt easy, climbing stairs, carrying groceries, walking longer distances, getting up from a chair, may begin to require more effort. That extra effort can make you feel even more tired, so you become less active again. The good news is that you don't need extreme workouts to interrupt that cycle. For many older adults, regular walking can be an excellent foundation for staying active. Resistance exercises can help maintain or improve muscle strength, while balance exercises can support physical function and confidence. Depending on your health and abilities, activities such as swimming, cycling, stretching, or other forms of movement can also have a place in your routine. What matters most is choosing activity that is appropriate for your current condition and progressing gradually. If you have been inactive for a long time, you don't need to suddenly train like an athlete. Start at a level you can manage safely, build consistency, and increase the challenge gradually as your body adapts. If you have significant medical conditions, pain, or limitations, it's reasonable to discuss an appropriate exercise plan with your healthcare professional. I also want you to remember that the goal isn't simply to burn calories. Maintaining muscle and physical capacity can make everyday movement easier, which can help you stay independent and participate in the activities that give you energy and enjoyment. I'd love to hear about your own experience. What activity makes you feel the most energized? Walking, gardening, swimming, working out, playing with your grandchildren, or something else? Or is there a physical activity that has become noticeably harder for you over the years? Share it in the comments. And don't underestimate the importance of this connection. Sleep and nutrition provide the foundation, but your body also needs regular movement to use and maintain that capacity. Next, we'll look at another group of factors that can quietly drain energy: medications, stress, and the everyday habits that may be wearing you down without you realizing it. Sometimes the reason you feel tired isn't one major problem. It can be several smaller factors quietly adding up until, together, they leave you feeling drained. This is particularly important to consider if your sleep and diet seem reasonably good, but your energy still hasn't returned. Let's start with medications. As we get older, many men take more than one prescription or over-the-counter medication, and some medicines can cause fatigue, drowsiness, dizziness, or changes in sleep. That does not mean a medication is necessarily inappropriate for you. It simply means that if your energy has changed, your medications are worth reviewing with your healthcare professional. Please don't stop, skip, or change a prescribed medication on your own. Your doctor or pharmacist can determine whether a medication, dosage, combination, or timing could be contributing. Stress is another factor that is easy to underestimate. Ongoing work pressures, financial concerns, relationship difficulties, caregiving responsibilities, or simply carrying too much mental strain can affect sleep, concentration, motivation, and physical energy. Even when you don't describe yourself as stressed, your body can still be responding to prolonged pressure. Alcohol can contribute as well. Although it may make you feel relaxed or sleepy initially, excessive alcohol can interfere with sleep quality and leave you feeling less rested the next day. Irregular schedules can have a similar effect. Going to bed and waking at dramatically different times, skipping meals, being inactive for long periods, or having an inconsistent daily routine can make it harder for your body to establish predictable patterns, and these factors often overlap. Perhaps you sleep poorly because of stress, exercise less because you're tired, drink alcohol to unwind, and then wake up feeling exhausted the next morning. None of those factors alone may seem dramatic, but together, they can create a cycle that keeps your energy low. However, I don't want you to conclude that every case of persistent fatigue is a lifestyle problem. Sometimes low energy is the first noticeable sign that something medical needs attention. Conditions affecting your blood, thyroid, blood sugar, heart, kidneys, sleep, hormones, or other systems can all potentially contribute to fatigue. That is the open question I want you to keep in mind. If you've improved your sleep, nutrition, activity, and daily habits, but you're still consistently exhausted, could your body be signaling something that deserves a closer look? In the next section, we'll examine the medical conditions that can sometimes hide behind persistent low energy and why recognizing the pattern matters. If you've been consistently low on energy despite making reasonable changes to your sleep, nutrition, activity, and daily routine, I want you to consider another possibility. Sometimes fatigue is a symptom of an underlying medical condition. That doesn't mean something serious is necessarily wrong, but persistent fatigue deserves more attention when there is no clear explanation for it. For example, Anemia can reduce the amount of oxygen carried through the body and leave you feeling weak or exhausted. Thyroid disorders can affect metabolism and energy levels. Diabetes and other problems involving blood sugar can also contribute to fatigue. Cardiovascular conditions may make ordinary physical activity feel unusually demanding, while chronic kidney disease and other systemic conditions can affect how you feel in less obvious ways. Sleep disorders deserve another mention because they can be medical conditions in their own right. If you are sleeping for what seems like enough hours but remain extremely tired during the day, the quality of your sleep may need to be investigated. Mental health matters as well. Depression does not always appear as obvious sadness. In some men, it can show up primarily as low motivation, loss of interest, poor concentration, disrupted sleep, or a persistent sense of exhaustion. These symptoms deserve the same seriousness and compassion as physical symptoms. Hormonal changes can sometimes be relevant too. Testosterone levels generally decline with age, and low testosterone can be associated with symptoms such as reduced energy, lower sexual desire, decreased muscle mass, and changes in mood. But I want to be very clear. Fatigue by itself does not prove that testosterone is low. Hormonal treatment should never be based on symptoms alone without appropriate medical evaluation. This is why I describe fatigue as a symptom, not a diagnosis. Your body is essentially telling you that something about your normal level of function has changed, but the symptom itself doesn't tell us why. The goal is to identify the underlying cause rather than simply covering up the feeling of tiredness. If you've been experiencing low energy, tell me in the comments how long it has been going on. Has it been a few weeks, several months, or longer? That timeline can be an important part of understanding the pattern, and there are certain changes I don't want you to ignore, particularly when fatigue appears suddenly, becomes significantly worse, or occurs alongside other symptoms. In the next section, I'll explain when low energy should move from something you're monitoring at home to something you discuss directly with your doctor. If your fatigue has become persistent, unexplained, progressively worse, or unusually severe, this is where I want you to stop assuming it is simply part of aging and talk with your doctor. You don't need to wait until you're completely exhausted or unable to carry out your normal activities before bringing the change to someone's attention. There are certain symptoms that make that conversation particularly important. Unexplained weight loss, persistent fever, significant weakness, or a sudden and noticeable decline in your ability to perform activities you previously handled comfortably should not be ignored. The same applies if you develop shortness of breath, chest discomfort, fainting, or a major and unexplained change in your exercise tolerance. I also want you to pay attention to neurological changes. New problems with balance, coordination, speech, sensation, strength, or confusion deserve appropriate medical attention rather than being attributed automatically to getting older. And if your sleep has changed dramatically, particularly if you are experiencing severe daytime sleepiness, repeated nighttime awakenings, loud snoring, or episodes of gasping during sleep, that is another reason to speak with a healthcare professional. When you make an appointment, don't feel that you need to have the diagnosis figured out beforehand. That's the doctor's job. I would want to know when the fatigue started, whether it is constant or comes and goes, what makes it better or worse, how you're sleeping, what you're eating and drinking, how active you are, and whether you've noticed any other changes in your health. Your doctor may also review your medications and supplements because some can contribute to fatigue or drowsiness. Depending on your symptoms and medical history, they may decide that certain tests or examinations are appropriate. The exact evaluation should be individualized rather than based on a single checklist that applies to every man. And that's an important distinction. The goal isn't simply to give you something that makes you feel more energetic for a few hours. The goal is to understand why your energy has changed in the first place. If the cause is a sleep disorder, nutritional problem, medication effect, hormonal issue, or another medical condition, identifying it gives you a much clearer path forward. So if your energy has changed significantly and you can't explain why, don't dismiss the signal. Your body may be telling you that something deserves a closer look. And now, let's bring everything we've discussed together into a practical approach you can start applying going forward. The first thing I want you to remember is that persistent fatigue should not automatically be blamed on aging. Yes, getting older can change your stamina, recovery, muscle mass, sleep, and metabolism. But a dramatic or ongoing decline in energy deserves a closer look, especially when you can't explain why it's happening. Start with your sleep. Aim for a consistent schedule and give your body the opportunity to get restorative, uninterrupted rest. If you snore loudly, wake repeatedly, gasp during sleep, or remain extremely sleepy during the day, talk with your doctor rather than simply trying to sleep longer. Then look at how you're fueling your body. Choose a balanced, nutrient-dense eating pattern that provides adequate protein, fiber-rich foods, nutrient-dense carbohydrates, healthy fats, and appropriate hydration. You don't need a perfect diet, but your body does need consistent access to the nutrients and fluids required to function well. Next, keep your body moving. Walking, resistance exercises, balance work, and other appropriate activities can help preserve muscle and physical capacity. You don't need extreme workouts. Start from your current ability, progress gradually, and choose activities that you can perform safely and consistently. I also want you to review the less obvious contributors. Your medications, alcohol intake, stress levels, sleep habits, daily schedule, and activity patterns can all influence how energetic you feel. If you suspect a medication is contributing, don't stop it on your own. Discuss it with your doctor or pharmacist. And finally, don't ignore persistent or unexplained fatigue. If your energy continues to decline, becomes unusually severe, or appears alongside symptoms such as unexplained weight loss, shortness of breath, chest discomfort, fainting, significant weakness, persistent fever, or new neurological changes, seek appropriate medical evaluation. The central message is simple. Getting older does not mean you have to automatically accept a dramatic loss of energy. My goal is not to promise that you'll feel 20 years younger overnight. It's to help you identify what may be draining your energy and address the factors that can realistically be improved. If this video helped you see your energy in a different way, subscribe to the channel and share it with another man over 60 who may have quietly accepted constant fatigue as just part of aging. Sometimes, simply understanding that there may be a reason behind the fatigue is the first step toward doing something about it.